Good day, welcome to day 376 at the EMA office where we bring you the latest in the COVID numbers. Along here with the chairman, Mark Kern, and today we have the operations manager, Randy Randolph. Randy, you have the numbers today.
I do, thank you, Director. So for St. Clair County totals, we've tested 307,845, which is an increase of 690 since yesterday. Of those tested, 29,150 were positive. That's an increase of 38 since yesterday. Those were both males and females under the age of 10 through their 60s. It brings our daily county positivity rate to 5.5%. Negative test results for 278,695. For deaths, unfortunately, we are adding one additional death today. That was a male in their 50s with underlying health conditions, bringing our total to 467, and our thoughts and prayers go out. For those that have completed the IDPH required 10-day isolation period, it's 28,285. For state totals, we've tested 19,805,516. Positive test results was 1,227,708. That's an increase of 2,793 since yesterday. For deaths, the state was reporting an increase of 20 deaths since yesterday, bringing the total to 21,136. For our hospitalization numbers, those currently hospitalized in St. Clair County are 25 patients, and 4 of them are on ventilators. Regionally, we have 56 patients hospitalized and 5 are on ventilators. For our congregate living facilities and outbreak status, we have no changes for that today. Remember that testing is still vitally important, as we see only 690 tested in the last 24-hour period. So testing is widely available still at multiple pharmacies, the testing site at St. Clair Square. So it's out there. If you're feeling symptomatic or you've come in contact with someone who is feeling sick, it's a good way to go get tested. It's free. You don't have to have insurance, and you usually get results within 24 to 48 hours, so it doesn't take very long to get that information back. So with that, I'll turn it over to you, Chairman.
Great, thanks, Randy. And it's also a good time to make an appointment at the mass vaccination site.
It is.
Plenty of open appointments. I think the average time that people have getting there, getting through it, getting a shot, and even waiting the required 15 or 30 minutes is right around 30 minutes. I mean, people are really getting through very quickly, and so now is a good time. If you qualify, get a shot. You know, if you've got a pre-existing condition, if you work for government, if you're above the age of 65, get in there, get a shot.
Definitely, and they can visit the St. Clair County website to find the vaccination screening page to see if they qualify under those tiers. And also, if you're having any difficulties getting registered for an appointment or are not sure if you qualify, you can call our call center at 825-4447 or 509-6010. And that information is posted on our EMA page, and the call center staff will be happy to assist you in answering any questions that you have or making you an appointment.
We can hear them right now talking to people, and it's very friendly, and it's a nice way to get signed up and get your shot.
Yes, very good. Thanks,
Well,
sir.
I mean, we encourage them, if you're not sure, to call in because there are several underlying conditions that would qualify you. So if you're not sure, call the health department the call center, and they'll be able to tell you what those qualifications are. I had a few people call today and say, well, I've got this, which it qualified them. So if you're not sure, call the call center and they'll be able to help you.
Yeah, if you think you qualify, give us a call, and likely we will have the answer for you, and hopefully we'll get you a shot, and you'll get there, and you'll feel good. It feels good to get a shot and to know that we're on the road to immunity here in the county. So, thanks, Team St. Clair.
Absolutely.
Okay, let's take a look at the zip code report. 62201 goes up 2 today to 574. 62204 is up 1 to 393. 62206 up 2 to 1,299. 62208 up 1 to 1635. 62220 up 3 to 2,087. 62221 up 3 to 2,790. 62223 up 3 to 1,768. 62225 up 1 to 142. 62226 up 1 to 3,217. 62232 up 1 to 905. 62243 up 1 to 779. 62258 up 3 to 1,060. 62264 up 4 to 363. 62269 up 4 to 3,281. And 62285 up 4 to 576. 38 new positives, 690 people tested, brings that daily county positivity up today to 5.5%. That in turn brings the rolling average up to 4.5%. And the regional positivity also today is up to 3.3%, derived by the fact that Bond County's at 0.8 today, Clinton 4.3%, Madison 5.9%, Monroe County 7.1%, Randolph 1.8%, St. Clair County 4.5%, and Washington County tops it out today at 8%. Herb, we just continue to roll along, day 376. That's a lot of days.
A lot of days, and some of the things we still got to keep track of. 690 positives since yesterday. That tells us that the virus is still out there, statewide.
690 tested.
Tested,
Right, which is a good thing. We could use more people getting tested, but 38, positives out of that is a good number.
And then statewide, that's one of the higher numbers we've had in a while. So, as Randy said, the testing is, one member on here said they just went and got tested. There was only one car out there, and by the time they left, there was 3 or 4. So, the testing side is there, and you want to get tested because it's out there.
And we actually, Brian will know, we ended up on the watch list again
We did.
because of a couple metrics.
Our cases, amount of cases per 100,000 and total amount of deaths last week, there was an increase. So we're one of 3 counties on the watch list for this week.
So we're on the watch list. We don't want to be on the watch list, and we all know that the numbers are far better than they were. Let's get vaccinated. Anybody that qualifies really should get out there. Let's get this immunity here so that we can get back to normal and that we don't have to worry about being on the watch list. If you get a shot, you're not going to get COVID. That's basically, or if you get shot or shots, depending on what brand you get, you're going to likely be immune to COVID.
Well, and the other number that we got to really watch, the last several deaths that we've had have been the younger age. Today was in the 50s, and last week there was 50s and 60-year-olds where
That is young.
that's young. That's really young, and that's an alarming young. So just goes to show you it's out there, and we want to lock this virus up and get it out of here. And as the chairman said, we do that by everybody. If you feel that you're qualified for the shot, like I said, call and we'll get that appointment made. And the masked people down there, Sam and Mila and everybody at the fairgrounds is there, and they'll put the needle in your arm, and you'll be one step closer to helping get this behind us and be a part of the solution here. And so I can't wait till that day comes. So.
Me too. And if you're out and you think there's going to be a crowd, I know they're starting to do events again. Wear your mask. Wash your hands. Watch that social distance if you can. But wearing this mask is a big deal now, and it's going to help to be able to get those numbers and keep them low. Get them low and keep them low.
And I got to say, I'm impressed that when I'm out, I am seeing a lot of our citizens wearing the mask, whether it be in the stores or in the quick markets or wherever it may be. So it's a lot different from what it was several months ago. So I think Team St. Clair has really helped get that word out there, and let's just continue to go, keep moving forward. We'll be back with Cindy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for day 377. Have a good evening.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this daily virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.